All right, everyone, buckle up, because today we are diving headfirst into a case that screams veterinary diagnostics puzzle.
Ooh, I like the sound of this already. Hit me with it.
We've got a 5-month-old Holstein calf, totally unable to use its back legs.
Okay, paralysis in a young calf definitely sets off some alarm bells.
Mm.
What else?
Here's the kicker.
Oh,
This wasn't this calf's first rodeo, so to speak.
oh, so there's history here.
Turns out this little one had already had surgery at just 18 days old to remove some kind of growth from his back. Fast forward a few months, and bam, paralysis.
Same area of the back?
You bet. The Open Veterinary Journal did a deep dive on this one, and they were not stingy with the imaging. Ultrasound, centesis, myelography, CT, scan, the whole 9 yards.
Whoa, they went all out. This must have been one complex case. All right, so walk me through it. What were the initial findings?
So the calf comes in, can't walk, and the vet examining them immediately notices muscle wasting in the hind legs, plus some neurological deficits.
Yeah,
That points towards a problem with the lower motor neurons.
definitely. But there are a lot of things that can cause lower motor neuron issues. Do they have any ideas based on the location and the history?
That's where the imaging journey starts. First up, ultrasound, which showed a complex cystic mass right near that old surgical site. Big red flag, right?
Huge, especially with the history of a growth in the same spot. But ultrasound can only tell you so much, right? Like, it can be hard to tell a hematoma from an abscess or cellulitis just by looking at the ultrasound image.
Exactly. And knowing what you're dealing with is crucial before you even think about treatment.
Huh.
So what do they do next?
Well, to really nail down a diagnosis, they went for ultrasound-guided centesis.
Centesis, so they actually got a sample from that mass. Makes sense. What did that tell them?
They found E. coli in the fluid.
E. coli. Common culprit in farm settings. Makes you think about potential for spread, biosecurity, the whole deal. But back to this calf. How did they figure out how much this E. coli abscess was actually affecting the spinal cord itself?
Myelography and CT, my friend.
All right, break those down for me. What do those images actually show? And what makes them so important when you're suspecting spinal cord involvement?
Okay, so with myelography, you're injecting a contrast agent directly into the spinal canal. That contrast shows up bright white on x-rays, basically outlining the spinal cord.
So if there's any compression on the cord, you'd see it on the myelogram.
Exactly. Any compression would interrupt the flow of that contrast, giving you a visual clue about where the problem is. And in this calf's case, they found a partial blockage of the contrast right at the level of the second and third lumbar vertebrae. L2, L3, sure.
203. Got
Uh,
it. That's right where that mass was on the ultrasound, right?
Right on the money. But here's where it gets even more interesting. The CT scan confirmed that compression at L2, L3 caused by the E. coli abscess, but it also showed something they couldn't have seen on any of the other images.
Oh, what is it about CT scans that let them see something the other imaging missed?
They found that this calf had missing and deformed spinal bones in the exact same area as the abscess.
Hold on. So this calf had an underlying bone condition that wasn't caused by the abscess itself.
You got it. This calf had a pre-existing condition called spina bifida.
Spina bifida. Okay, so not directly caused by the abscess, but definitely complicating things, I'd
You
imagine.
say that again. This abscess on top of pre-existing spina bifida, that's a recipe for disaster.
Talk about bad luck. Poor little guy. So they've got this complex picture. They're about to go into surgery, but first they do one more test, CSF analysis. Why analyze the cerebrospinal fluid when they've already got all this imaging data? What were they looking for?
Well, with CSF analysis, you're basically looking to see if the infection has spread beyond that abscess and into the central nervous system itself. Plus, it can pick up on any inflammation happening within the spinal cord.
So it's like double checking that the infection hasn't gone totally rogue, even if the imaging looks somewhat contained.
Precisely. And in this calf's case, the CSF came back normal.
Okay, so that's at least one good sign for this little guy. Infection seems to be localized to the abscess itself. You'd think that makes surgery a little more straightforward, right?
You'd think so, but not so fast. The surgery ended up being really complicated. The report described the mass as firmly adhered to the spinal cord.
Oh man, that sounds tricky. Like trying to peel a sticker off an orange without getting any of the pith. Did they have to get creative with their surgical approach because of that?
They absolutely did. They actually brought in intraoperative ultrasound to visualize the spinal cord in real time during the surgery.
Wow, imaging right in the operating room. I mean, they already had the myelography and the CT. Why ultrasound on top of all that?
Well, it let them immediately see if they were causing any additional damage while they were trying to remove the mass. Remember, we're dealing with an incredibly delicate structure here, and even with a skilled surgeon, there's always that risk of causing more compression or trauma when you're removing something so stuck.
So it was about doing damage control in real time.
Exactly. They needed to see the effects of their actions immediately, not after the fact.
Makes sense. So what did that intraoperative ultrasound show? Were they able to get the abscess out without causing more damage?
Unfortunately not. The ultrasound showed interruptions and some distension of the central canal.
Okay, for those of us who don't stare at spinal cords all day, what's the central canal again? And what do those ultrasound findings tell you?
Imagine the spinal cord is like a straw. The central canal is the hollow space that runs down the middle of that straw, and it's filled with, you guessed it, CSF. So when they see interruptions and distension, that means that canal, which should be a nice clear pathway, is now narrowed or potentially even blocked in some areas.
Ugh, that doesn't sound good at all. It's like, even though they took the abscess out, the damage was already done, right? Like the compression from that mass had already taken its toll on the spinal cord.
That's exactly it. And sadly, even after all that, the calf's condition didn't improve much, still couldn't use those back legs.
Oh man, that's just heartbreaking. Especially after such an intense surgery and the hope that removing that abscess would actually make a difference. What happened next? What's the final chapter for this little guy?
Yeah, sadly, because of the poor prognosis and because the chances of this calf having a decent quality of life were so slim, the difficult decision was made to euthanize.
Always a tough call, but sometimes it really is the kindest option. This whole case has been one roller coaster ride.
No kidding.
I mean, it really drives home just how tough veterinary medicine can be. You know,
Yeah.
you've got this young calf, a congenital condition, a previous surgery, and then bam, this aggressive infection on top of it all. It's a lot,
It really highlights the importance of early diagnosis, doesn't it? Catching these things early before they spiral.
for sure. I mean, who knows? Maybe if they'd caught this abscess sooner, they could have intervened before it did so much damage to that already compromised spinal cord.
It's possible. And, going back to that initial surgery, it's pure speculation at this point, but just a thought. What if some tiny microscopic part of that first growth, that pulmonary choristoma, was left behind?
And that created like the perfect little breeding ground for that E. coli to take hold.
Exactly. It's like, when you think you've put a fire out, but there's this tiny ember still smoldering away?
And then boom, backdraft.
Exactly. And that spina bifida, that just made this calf a sitting duck, really.
Yeah, just a terrible combination of events. This case really makes you stop and think, like how should we be approaching these kinds of presentations in practice? What subtle things should we be looking out for, even in cases that seem routine at first glance?
It's about thinking critically and using every single tool at your disposal.
Absolutely. And sometimes it's about trusting that little voice in the back of your head that says, hmm, there's more to this.
Couldn't agree more. You've got to follow your gut.
This deep dive has given us all plenty to chew on, that's for sure.
Mm-hmm.
Any final words of wisdom from Vet Neurochar?
From Vet Neurojar. Keep those minds inspired, hearts light, and tails wagging.